Jason and Daniel's video on syncope, they mentioned that I was going to talk a little about 12-lead ECGs for EMTs. The thing that I want to tell you is acquisition of a 12-lead ECG is a basic skill. Interpretation, on the other hand, is a paramedic skill. So the expectation for our EMTs is that you obtain a 12-lead ECG in two groups of patients. One is those that you suspect of having ACS, acute coronary syndrome, and the other is those patients with syncope. If it is an ACS patient, if the machine interpretation says star, 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 STEMI, and chest pain is the patient's primary complaint, then consider that a STEMI and notify the hospital of a STEMI and transmit the 12-lead ECG to the hospital within 10 minutes of acquisition. This is very specifically done to improve the outcomes of those patients. Now, if you have a paramedic there when you do the 12-lead, this is not something you have to worry about. But if there is no paramedic on scene, then the expectation is you get the 12-lead, you give the aspirin. If it says STEMI and they have chest pain, then you call the hospital, transmit, and let them know. And if you don't have a paramedic available anytime soon, you can go ahead and transport BLS. You don't need to wait on scene for a prolonged period of time just because they're having a STEMI. And as a matter of fact, if they're having a STEMI, that is a better argument for you to transport rapidly. Now, what is the time period that you need to get a 12-lead on a syncope patient? Just before you get to the hospital. So if you are going to transport the patient to BLS, just get the 12-lead at any point and hand it to the doc. Make sure they see your 12-lead. Again, this is about improving the care of our patients. Now, here is a note on documentation. So I sat down with Daniel Ebbett and we talked about how you import these things into ImageTrend, what you document, and then whether you need to get a paramedic to interpret it. So first things first, if you don't have a paramedic on scene, you do not need, and please don't do this actually, do not call for an ALS response. Don't do a supervisor consult solely to interpret a 12-lead on a patient that you would not otherwise ask for help on. So if you think this patient is completely stable, you're doing the 12-lead to make sure it doesn't say STEMI or for that syncope patient, but you wouldn't otherwise ask for an ALS intercept, then don't ask for an ALS interpretation. If there is no paramedic on scene, just import the monitor into your chart, just like you would do with vital signs. It will go ahead and import the 12-lead in, and that will show that you did it. But if you don't have a paramedic listed on your crew, then the validation rules aren't going to expect an interpretation. So from a billing standpoint, you can do the 12-lead, and again, that's expected, but don't do the interpretation if there's no paramedic there, because you're not credentialed to do that, and that can constitute billing fraud. None of us want any part of that. The good news is, again, if there's no paramedic, you can't put an interpretation in. That will be grayed out. If there is a paramedic on scene, add them to the crew and then ask them to do the interpretation part. That is the done by, so who did the 12-lead and then what their interpretation is. If they did any other ALS procedures, be sure that you document those ALS procedures along with the ALS crew member who did it in the correct spot. That is the pull downs, that is the devices, the medications, the procedures section. Don't just write it in the narrative. That's not sufficient. And then if there is an ALS person on scene and they don't think that this is an ALS patient and we meet all of the BLS criteria, make sure they do the ALS to BLS handoff on the chart. So if you do these things, we're helping improve the care of our patient, and it's going to save you from getting those QA messages in ImageTrend asking you to go back in and fix the chart. Save yourselves that and help us improve the care of our patients. Guys, thank y'all very much and have a great day. And as always, thank you for what you do.